the small town of Bryan, Ohio, a community hospital barely survives. At the same time, the people it serves struggle to stay healthy as good-paying jobs disappear. Brian Alexander's new book, The Hospital: Life, Death, and Dollars in a Small American Town, takes a deep look at what's broken in the healthcare system. The contributing writer for The Atlantic makes a complex story understandable while showing us the very real effects of inequality on the people of the town.
Americans die earlier, Americans live less healthy lives, and yet we pay far more for healthcare in this country than anybody else does. We are doing it wrong.
It's such a well-researched book. It's amazing. It's just a great work of journalism. And just hearing you talk about it, I can see how deep your understanding is of this.
Thank you. I mean, it was 3 years in the making, and I basically did nothing else for 3 years. I moved to the town. I thought to myself, once I was there, that there was a much bigger story here than just about one hospital in one town. And there was a bigger story even than about the American healthcare system. It was a story about how our economic system, especially over the last 30, 40 years, has affected the health of Americans and the lives of Americans. And I could tell that story through the lens of this one hospital.
Your book has a cast of characters. It's not just a, sort of dive into the research about the hospital, but there's a whole cast of characters that humanize this story so much. I wondered if we could talk about them a little. Like I was just thinking about the person, Keith, the man named Keith, who worked at Menards.
Right. Keith worked in auto-related manufacturing, lost his job in the Great Recession, managed to get another job, a relatively decent job, got married, had a baby. His wife, unfortunately, had a very serious medical problem. I don't want to give too much away, but Keith ended up working at Menards for $14.50 an hour. And the policy there is that you've got to be there 90 days before you can sign on to health insurance. And once you do sign on to health insurance, deductibles can be as much as $5,000. And it's expensive. The employee's contribution is quite expensive. And this has a cascade of effects on Keith and on Keith's family. It's not so much that Keith, who was diagnosed with diabetes, is unique. Keith is not unique. In this country, many, many people with diabetes are rationing their insulin. They're not taking their insulin because they can't afford it. And there is a series of consequences that results when you do not address your diabetes properly. People are literally stuck between the choices of going broke or dying in this country. And Keith is faced with those choices.
Has the Affordable Care Act helped any of this that you've seen?
Yes. There's a good chance that the hospital in Bryan, Ohio would have closed without the Affordable Care Act, because many more people could afford health insurance with their subsidies, especially in a community like Bryan and surrounding Williams County, where people are barely keeping their heads above water.
This is a really human book, and so I think there's a lot of misunderstanding between small towns and larger cities and so on. And this really humanizes the people in this town of Bryan, Ohio, and makes me think about people around me. So
thank you. But that's exactly what I was trying to do. So I appreciate your comment. It's gratifying.
Scan the QR code on your screen with your phone's camera to watch the full interview and find out what Brian thinks would help the healthcare system and who profited the most during COVID.